Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the president says no to a nationwide modified general community quarantine without a vaccine rollout. And the Food and Drug Administration approves the emergency use authorization of China's Sinovac vaccine. But some senators are raising concern on Sinovac's emergency approval. Infectious diseases expert Dr. Rontgene Solante and health reform advocate Dr. Tony Leachon join us live. The president has decided there will be no further easing of quarantine restrictions without a vaccine rollout. In a statement, Malacanang says President Rodrigo Duterte, quote, recognizes the importance of further reopening the economy and its impact on people's livelihood. However, the president gives higher premium to public health and safety. Presidential spokesperson Harry Roque adds Mr. Duterte wants vaccination to start the soonest possible time in order to ease the community quarantine. Experts and government officials have conflicting views on the shift to a modified GCQ. Here's the take of Health Secretary Francisco Duque when I spoke to him here on The Source yesterday.
So far, tingin natin kakayanin naman, no? So we will never be able to know until that situation actually evolves, no? Whether the system is ready. So we'll see. Well, the important thing is we are nimble, we are agile.
So I asked you a while ago, are we ready to shift to the more lenient MGCQ?
I think we are ready. I can say that because after 1 year, we have managed to keep our infection rate manageable. When I say manageable, it is at a level that has not overwhelmed the healthcare system.
The Octa Research Group warned of the possibility of more than 2,000 daily cases in Metro Manila if we revert to MGCQ. At this time on Monday, the country recorded over 2,200 new infections, with the National Capital Region still leading the overall tally. Let's go straight to the source of the story. We have San Lazaro Hospital.
This looks different.
It is. Epic high-res photos and 8K video beyond cinema quality.
This is different.
Told you.
Welcome back to The Source. As I was saying a while ago, we will speak to Dr. Rontgene Solante. Sorry about that. We had technical difficulty. Dr. Solante, let me already ask the first question. Your reaction to the president's decision not to shift to MGCQ?
Well, as frontline healthcare workers, that's quite relief for us, no? Because we still do have time, a lot of time to really prepare. Although we are prepared now, if in any case the transition from GCQ to MGCQ, no, and that's the important part there. That for the past months, our cases are stabilized, and we have this enough time to be ready for the MGCQ. But since the president more or less prioritize the safety of the public over that of the what we call the economy, then we will still continue to abide by that and prepare ourselves for the cases to occur or to come.
Were you at all worried when Okta Research Group was saying that if we actually shift to MGCQ by March 26, NCR could record about 2,400 cases a day? Hence, looking back, that would be the same number, or at least the kind of status we had back in August when the hospitals were overwhelmed.
Okay, Pinky, no, our preparation has already factored in those information that if in case there will be surge of cases like 2005 or even 3,000, then we have to be prepared. We are preparing the facilities to accommodate if in case there will be surge of these cases.
So you're telling me right now, Dr. Solante, in the event that we actually reach 2,400, you even said 3,000, you feel, your assessment is kaya pa po ng mga ospital and kaya pa po ng ating mga doktor at healthcare workers.
Yeah, precisely. No, but the experience we have already for the past 12 months taking care of these COVID patients has somehow made us more prepared in terms of how we're going to do and what are we going to do for in case there will be surge of cases, both in the clinical management, in the infection control, and also in the prevention of this infection while in the hospital. So more or less our preparation now compared to 12 months ago is more or less we are already prepared for that.
You know, that's really good to hear because of the actual possibility na pwedeng tumaas po yung numbers. And look at the past couple of days. Dr. Solante, yesterday, we recorded the highest case, I believe, in the past 3 months. The day before that, it was also over 2,000. The day before that also was about, we're averaging, let's say, about 2,000 cases the past 4 days. So, in effect, parang tumataas po yung mga numero.
Yeah, that's the reason why that we always emphasize the importance of really following the minimum health protocols. Because as you can see now, when you go out, a lot of our population are already like looking at that they are already in the MGCQ, not the GCQ. No? So there is really complacency in these health protocols, and the only way to I don't know if it's how we can make this make them change their behavior, because it's already the behavior that will set in among our people to really emphasize the importance of these minimum health protocols.
It's good you said that also, Dr. Solante, because a big responsibility really lies on each and every one of us to really follow the minimum health protocols, ni Huba. Maybe because after a year, people are starting to, there are some people who are starting to relax.
Yeah, I agree. Yeah, we need to learn how to live with the virus, but we need to learn that when living with the virus, we will not be living as what we did before when the pandemic was not yet here. We are still in the pandemic. The virus is still here. There is still ongoing local transmission. The more we should be compliant with the health protocol. Social, physical distancing, wearing of face masks, and gathering. These are the important factors that we see every day. Why are we having such cases? So those are the things that we need to really implement and emphasize.
But it's also good to note that there have been studies that actually point to, I think one is in Quezon City, that how they see this COVID-19 transferring from one person to another is that it seems that it's coming from also the workplace. And then from the workplace, inuuwi po ito sa kanilang pamilya.
Yeah, correct. Because we've already seen those dynamics of the transmission. Because we always expect that when you open up the workplace, you have lots of people there. Then chances are there will always be violation in terms of the physical distancing, wearing of the mask or the face shield, and that is expected. And that's the reason why that when we open up, increasing the capacity of business establishment, these establishments should always make sure that the safety measurement in that establishment should be followed always.
Do you even suggest, Dr. Solante, that we should be stricter with ourselves now? Because obviously we have eased restrictions. Kahit na po, yung iba nga ho sinasabi, we want to shift to MGCQ, but others are actually saying, this is just really terminology, when in fact, it's almost as if nasa MGCQ na rin talaga ang Metro Manila.
Yeah, tama ka. Kasi kung titingnan mo ngayon ang nangyayari, parang MGCQ naman ang dami ng tao sa labas, no? And then we see the cases, it cannot be denied that the cases are still there. We haven't averaged less than 1,000. So we're still between 1,000, 1,500 or less than 2,000. No? But again, that's the reason why that the implementation here, the compliance of the protocol should be both, not only for individual, but there should also be measures in the workplace that should be strictly followed.
Let me ask you though, personally, when will you start getting worried? When the COVID-19 infections per day rises to what number, Dr. Solante?
Okay,
Kailan po siya sasabihin niyang, okay, medyo nakakatakot na ito?
Ang sa amin kasi, ang nakakatakot sa amin as infectious disease or those taking care of the COVID patients, if our ICU, the critical care unit, napupuno, no? Because these are the people that have the higher risk of mortality. Remember, we always equate vulnerability, burden of COVID to the mortality, number of people who died because of COVID. Yung mga mild, okay lang yan, walang problema yan, no? Kasi they will always survive. But how about those who are really critically ill? That's the most important impact. Why that if the healthcare unit tumaas na yung critical care utilization ng unit nila, then that's already something that we have to be alarmed with.
Okay. All right. I wanted to also quickly talk to you about the emergency use authorization given by the FDA on Sinovac. There are two factors that need to be talked about here. While they have an EUA, they've been granted an EUA, ang sabi po ng FDA, it's really not recommended for healthcare workers directly treating COVID patients and number two, senior citizens. Let's quickly go to the first point made by the FDA. Do you agree, sir, that of course with the, I know this reaches about, it's studied by three different panels before the FDA actually approves this. Do you agree na wag muna to gamitin sa mga healthcare workers directly treating COVID-19 patients?
Yeah. So my answer to that is that I think the FDA based that recommendation on the data that was given, no? Based on the phase 3 trial interim data. The first trial was done in Brazil among healthcare workers, high-risk healthcare workers who are seeing patients 2 to 3 times or every day. No? And then the efficacy data was only 50%. So if you're a healthcare worker, your risk of getting the infection every day because you're seeing these patients and you all are only protected 50%, then that's quite a high risk, no? 50-50 yan eh. So there are available vaccines that are that have higher efficacy. We want to get a better efficacy so that we will be putting the healthcare workers in a better position, protected, in taking care of the patient. And that's for me logical, no? Kailangan nating maintindihan yan.
It's good you cleared that up, Dr. Solante, kasi yung iba po are raising the alarm. Kung yung healthcare workers bawal, yung senior citizens bawal, baka hindi yan effective. Very clearly, you're saying that kasi yung lumabas sa trial, doon sa Brazil, 50.3, pero ang ginamit ho kasing sample population dito, yung mga doktor, yung mga healthcare workers who were treating, COVID-19 patients, but just the same, Dr. Solante, that still gives people like you a 50% chance not to contract the virus.
Yes, but again, if in case, ganito lang yan, no? Kung halimbawa, ibibigay pa rin yan sa amin dahil wala nang ibibigay, tatanggapin ko yan. A 50% is a 50%, better than zero. So that's just my point, no?
Yeah.
But if there is a possibility that we can get a higher efficacy for our healthcare workers, then we have to prioritize that because they're the ones taking care of our patients, no? For the general population, that's okay because 50% is your risk is not as high as that of the healthcare workers. So your protection is even better because you are not seeing a lot of these COVID patients. For the 60 years old, I think the recommendation there is that there was no data. Again, the data on the 60 years old has not been that good also. So why give the risk this vaccine giving to 60 years old? In fact, we haven't seen the data that it's effective for the 60 years old.
So it's almost as if, Dr. Solante, as a last question, hintay muna kayo, baka sakaling pumasok ang Pfizer, baka po dumating din ang AstraZeneca, which would have a higher efficacy rate for healthcare workers. Pero pag hindi pa rin po dumating sa lalong madaling panahon, okay na rin ho kayo sa Sinovac.
Yes, correct. Agree with you.
Okay. All right. So we need to find out, though, kung kailan ho dadating yung Pfizer and AstraZeneca from the COVAX facility. In the meantime, Dr. Rontgene Solante, sir, take care of yourself and thank you for your time.
Thank you, Pinky.
And coming up, senators are raising concern on the emergency use approval of Sinovac vaccine. Health reform advocate Dr. Tony Leachon will be joining us after the break. You're watching The Source on CNN Philippines. I'm Pinky Webb. Let's go straight to the source of the story. This time around, we have health reform advocate Dr. Tony Leachon. Dr. Leachon, good to have you again. And let me ask you already, do you agree? Are you happy that the president decided not to shift to MGCQ?
Well, I'm extremely happy with the president's decision, despite the economic managers of the IATF and even Secretary Duque and the Metro Manila mayors narrowly approved the recommendation of the IATF because the numbers are not really good and it's coming from the DOH. I mean, you need to, really own that particular data as if it's coming to the Department of Health. And it will not really, tell us another view. It is science and it is basically rational. Look at the numbers. We're hovering in the 2,000 cases daily. And then the reproduction number is 1.22. That's above 1. So that's increased transmission. The case fatality rate is also increasing. Right now, it's about 2.15. And the positivity rate, which is less than 5, is right now 6.8%. And you don't have a vaccines at this point in time, really, that would protect the population. So to me, it's clear-cut that the modified GCQ should not be implemented, knowing that you don't have the vaccine plus the other variables, plus the threat of the entry of the B117 in our country.
Yes. Dr. Leachon, that's exactly what I wanted to talk about because sabi po ni Pangulo, vaccine rollout muna before MGCQ. So, ano ho ba, what do you think, what is a safe guideline or parameter that the vaccine rollout has actually begun before we shift to an MGCQ? I guess that's a big question to me. Yung ilan ho kaya ang dapat ma-vaccinate bago masabi natin na nag-umpisa na yung vaccine rollout so we can actually shift to MGCQ?
Well, based on the Israel study, though maliit na population sila, 10 million, 50% of the population nila. But with our archipelago, I'm thinking of the National Capital Region being the PCES epicenter. So if you have a 13 million population, kahit 5 million Filipinos in the National Capital Region na bakunahan, that will be okay. You remember Israel, 24/7 sila nagbakuna. And then they started mid-January. And then 2 days ago, they actually came out with a study. Almost 98% lahat eh. Reducing hospitalization, reducing ICU, reducing severe illnesses. So ibig sabihin, in that short span of time, 2 weeks to 1 month, may impact na. So if we could actually have the vaccination, hopefully with the Sinovac Eua that will be given for 18 to 59, and the Pfizer coming in for the healthcare workers, and then Astra, of course, coming in. You have 3 vaccines right now that can be used in the National Capital Region. Dapat nating intindihin, since the limited supply, we must actually focus it on that particular area that would matter to our country. And it's the National Capital Region that is most important.
So you're okay. You're thinking that 5 million, which is obviously less than 50% of the population of NCR, that becomes a little safe now. Medyo safe na po yan para sa residents of Metro Manila. So let's look at what you said. The vaccines that could be made available. Number one, we're pretty sure that Sinovac will arrive. Ang sabi po ng Malacanang could be, in the next 3 days after the FDA approved its EUA. I asked the same question to Dr. Rontgene Solante. Meron lang ho kasing restriction sa Sinovac. Do not use it on healthcare workers directly treating COVID-19 patients, and no to senior citizens. Do you agree? Or was the FDA a little too cautious about Sinovac?
Well, firstly, I'd like to congratulate the FDA Director, Eric Domingo, and the staff and the vaccine expert panel. Because this is the first time na nakarinig ako ng mga ganyang klaseng dichotomy na pagka healthcare workers and senior citizen, hindi ka pwedeng gamitin. Because in the study in the Brazil, 50% efficacy rate. And then, you have naman 18 to 39 na pwede kang gamitin. That's really a bold move, no, for them. Kasi people will think na who will be the less fortunate people who will be given. I mean, special ba yung healthcare workers sa senior citizens? May pinagbatayan po sila, and yun ho yung kinabibilib ko ho eh. At yung details na yun to be broadcasted in public, that's really commendable. Ngayon, ang problema lang na challenges na nakikita ko from the FDA, Department of Health, and the IATF is the mixed messaging that we will deliver. Kasi I think this is driven because of the many surveys na nakita of their non-preference ng tao on the Chinese vaccine and preference on the Western vaccine. One example is the online study at 15,000 respondents from UST. Ganun din sinasabi. And then the latest, yung sa UPPGH, na when they heard na Pfizer ibibigay, the acceptability rate went up from 75% to 95%. So, and then sila yung nagko-contract din ng severe illnesses. Pero I was thinking na universal yung approval like in other countries na approved. In Indonesia, inapproval without these particular specifications. So, I think we need to understand yung difficulty ng ating FDA and the vaccine expert panel. And by doing this is a bold move. Yeah. Now, ang challenge lang natin right now is how to communicate it properly without, of course, damaging the product na makakatulong sa atin yung Sinovac. Because ang threshold na ginagamit ng WHO is 50%, and that would be effective. Kaya lang, may nagkataon silang na-specify na 50% sa Brazil because it's good in Turkey, 91%, and in Indonesia, 66%. honest lang silang masyado in telling it to the public. And there's nothing wrong with that. Honesty is the best policy. Ang concern lang natin is the messaging na ibibigay natin sa public.
Yeah. And do you think it becomes quite unfair for Sinovac, for example? Because as you mentioned, I mean, it's almost as if it needs to be repeated over and over again. Yung iba ho kasi natatakot dun sa 50.3% efficacy ng Sinovac. But then it has been explained over and over again that this was used on medical frontliners who were directly treating COVID-19 patients. So the exposure to the virus, napakalaki po nun. And yet, 50.3% of the Sinovac vaccine was effective. Ano po? And then, again, as mentioned by you, when you look at Indonesia, it's at 66%, and Turkey, over 90%. And let's also not forget the standard set by WHO. Okay na po yung 50%. Kaya lang, kasi po lumalabas, may Pfizer, nasa 90%, may AstraZeneca, nasa 90%. So, naturally, the people would gravitate towards the higher efficacy rate.
That's correct. And that's the reason why we want yung FDA to engage with the pharmaceutical companies na i-launch na yung mga produktong yan. In fairness, ang Gamaleya is 92% and meron silang Lancet peer-reviewed. So lumalabas na yung mga studies. What I'm saying right now, since Pfizer is not available because of the indemnity bill issue na napirmahan na, global tight supply for Astra, and you have Sinovac right now has EUA, meron na. Sinopharm is 77%, and then Gamaleya meron 92%. So what I'm saying right now, it's the messaging and the strategic communications of the PALAS, the IATF, malaking role dito. And if the IATF leaders, less than 60 years of age, like the vaccine czar, Secretary Nograles, I heard Mayor Isko, they're willing to be inoculated with Sinovac to boost up the confidence. This will help in the communication strategy of the government. Pagka naipakita nila ito in public, being injected dito sa deltoid area, that will actually boost up the confidence of the people. Ang kailangan lang natin ngayon, ipakita yon. And that's why the other countries, si Joe Biden, kasi President Joko Widodo nga, Sinovac yung in-inject sa kanya sa deltoid muscle, di ba? If remember. So what I'm trying to say, yun ang isa sa pinaka-importante. Leadership by example, and of course, promoting Sinovac, since ito yung ang kanilang i-push for 18 to 59, particularly for essential workers and uniform personnel.
Right. Okay. So let's wait for the arrival of the Sinovac vaccine, and we need to get an update, of course, from Secretary Carlito Galvez on the vaccines coming from the COVAX facility. In the meantime, Dr. Tony Leachon, sir, maraming salamat po sa inyong oras.
Thank you very much, Pinky. Keep safe.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.